So our speaker, Dr. Kevin McNeill, is a family physician, educator, and health system administrator for over 30 years. He and his wife and two children, one of the children are here today, by the way, have lived in Lehigh Valley for about 20 years. His professional interests include substance use disorders, advocating for primary care, and values-based care. And as a side note, I've told the story a few times. As I was talking about this event, my wife heard me talk about Dr. O'Neill, and she told me, oh, that's my favorite doctor. He was working in Trexlertown, and he moved to Hamburg, and one day she did go all the way to Hamburg to see him, but then she decided it was too far a trip. But anyway, so my wife is here to... So when you find a good doctor, you don't want to let him get away if you can help it. All right. Let's, we'll do some Q&A afterwards, and we'd like to use the microphone for Q&A because we record these events for people to review afterwards. Kevin, take it away.
Thanks, Jim. And one thing I'd like to do, Jim, if it's okay, is during the course of this topic, we'll have some questions for the audience. So not just at the end, if that's okay. So thanks, Jim, for that wonderful introduction. So I'm going to be talking about public health and the Make America Healthy Again movement. As I understand it, the key here is a family physician's perspective. So understand that I'm coming here not as an expert. I'm coming here, I wanted to take advantage of speaking to this group and learning from and listening to this group. So that is part of the reason why I asked Jim if I could do this. So a little bit of agenda and housekeeping for how we're going to run today. I'll give an introduction, tell you a little bit more about myself, although Jim, I think, did a wonderful job. And then I'd like to look at the sort of overlap of MAHA and public health, because there is some overlap, and I just want to note that there's some really terrible things going on right now, and I'd like to sort of not focus on that, keep on track with MAHA and public health, and maybe places where there's convergence. And sort of not, I know I would go off on tangents, my wife can tell you, and I'm going to try to keep focused here. And it's going to be a facilitated discussion, and I'm really just going to spend a few minutes talking about the problem as I see it, and then a little bit of time for discussion. And again, my wife is going to help me keep on time for that. And then hopefully we'll have time in the end just for an open forum so we can just sort of exchange ideas freely. So why MAHA would be the next section, and these are my ideas: mistrust, different information sources, dysfunctional systems, and poor health. And I've separated vaccines because, I don't know, that's just tough. That's a tougher topic, and there isn't necessarily as much overlap or areas of concession or collaboration, at least as I see it. So, as Jim said, I'm a family doc for 30 years, more recently a medical director of an accountable care organization, which you may not be familiar with. That has to do with Medicare folks specifically, and changing the payment structure so that it's not just based on utilization and doing things, but it's based on assessment of quality and controlling cost. Now, my interest there, my friend and colleague Ed is here. We've had conversations over time about the fact that it's just getting harder to do our jobs in certain ways, just because of the reality of healthcare. And there's an increase in alternative misinformation and disinformation. There's rising distrust. And so I'm asking for your help, quite frankly, like how different ideas of how to navigate this reality. So I'm going to take a moment to set the stage in terms of defining public health and MAHA, because if you ask 10 different people, you're probably going to get 10 different definitions of either one. So I decided to go straight to the source. So American Public Health Association defines public health as promoting and protecting the health of all people and their communities. So it's science-based, evidence-backed, and it's really focused on giving everyone a safe place to live, learn, work, and play. And that very broad definition is intentional. And then for MAHA, I think that's a really big tent there, at least from my understanding. Again, not an expert in MAHA. So I decided to go straight to how Secretary Kennedy defines it in the HHS site as an initiative to reform the nation's food, health, scientific systems to address the root causes of chronic disease and build a healthier, stronger America. So you can see just by, in terms of their, what I'll call their vision statements, there's some obvious overlap there. And so I decided to create this Venn diagram. And these are not my ideas. This is, again, straight from the APHA website in terms of the initiatives they're focused on, and straight from the HHS website in terms of the initiatives they're focused on. But you can see the overlap. They're definitely focused on chronic disease prevention, children's health, healthy food and nutrition, and environment. Now, I'm not going to read all these initiatives to you. The asterisk that I've included is just my own. So this is my view, and I welcome alternative views. The reason why I put an asterisk there is because I find these statements to be disingenuous from the HHS. So investigating the cause of autism, there's been research for years on this, and the research is done in a very specific and evidence-based way. And it's not necessarily what I'm understanding and seeing coming out of HHS. And then restoring trust in vaccine safety, it seems to me like the opposite is occurring. And then bringing radical transparency, also, I find that that's, from my perspective, not occurring. And so while I see there's a lot of overlap, and it's really important to highlight the overlap, and maybe it's an area for a potential for collaboration, the asterisk lets you know where I see the problems exist. And so with that, as I said before, I'm going to ask some questions, and my wife's going to kind of keep us on time. I'd like to get as many different voices as possible. And so if you're interested, if you want to answer these questions, what you see, and you could either choose the pro and con of the MAHA movement. And then if you decide to answer that question, raise your hand. Just tell me your name. So to the group, what are some of the pros and cons specifically of the MAHA movement? Pat.
I have one of each. And of course, the con is that it's being run by Kennedy. Mm-hmm. I can't take anything he says seriously, and I haven't for all the time I've ever followed him.
Yeah.
But the pros are we are a seriously unhealthy nation, mm-hmm. and we've been there quite some time, and I'm old enough to have been around, we've gone in like zigzagging directions, no carbs, yes carbs, yeah. No fat, yes fat, all this stuff. And I think we have a confused population, but I also think that we have a junk food population after I just had that donut. But, so that there are some of each. I've been lucky enough to travel a lot in my older life, and when I'm in most other countries, I do not see the obesity level that I see here, especially the severe, the 3 and the 4 and the 500-pound people that are suffering, right. With that. So yes, we have a lot of problems in this country, but for me, the con is I don't believe that this guy's capable of bringing people together on any level, and I don't trust anything he has to say. Yeah. He's like a joke for me.
Such good points.
I'm Terry.
Hi, Terry.
I do not disagree with Pat. What I will add is that I take Kennedy quite seriously, and I think it's dangerous. Yeah. And I don't know what I agree with what you said, basically that, a lot of this stuff is disingenuous, and he's really fighting, instead of, we're cutting all sorts of programs, all sorts of research, and that's seriously dangerous. I don't know what else to say about that. I would love to see this stuff be real.
Yeah, absolutely.
So.
What's your name?
Rachel.
Rachel.
Probably better actually talking. So I have lots of problems with MAHA, obviously, but one of my problems is those ones that you had as overlap.
Yeah.
I don't think that what MAHA says that they are concerned about, they're actually concerned about. Because if they were concerned about, say, environment, then they would really go into fixing our actual problems with our environment, and they don't. And if they were really concerned about, I forget, nutrition and that kind of thing, they would actually fix food deserts and actually being able to afford healthy food, and they're not at all interested in any of that. So I don't actually take them. I think they're very disingenuous on like everything they say, because they don't actually they're not actually interested in fixing the actual problems.
Anyone have an alternative point of view when it comes to, and it's perfectly fine if you don't, or if you have something else to add to that. Yes.
Last week I was in Cuba for a week and got to view the medical situation there. There they have nationwide health insurance, and you get immediate care unless there's something like a knee that you can wait a while, and they'll make you wait a while. But I noticed that the doctors there, and we met a couple of them, were not only interested in the normal medical procedures, but they were interested in natural solutions as well. And they would go out and find different things in the woods and so forth that do very well with that. And they didn't have any problem with that. The only really obese person that I saw there was the one that came in on our tour, who was about 300 pounds. But it was an American. And, they are taught to eat things that are useful for them, but they don't have any McDonald's there or any of the other types of things. And if they're worried as hell that Trump is going to invade, and I guess that means McDonald's and all the other things that will come with it, which is bad.
That's a good point. All right, Cyril.
Yeah, I think I've seen some really crazy secretaries over the years, but this one really is in a class by himself. So, I agree with everybody about most of the bad stuff, the vaccinations and the disseminating of disestablishing of a lot of these health protocols, especially for underprivileged. The one thing that I question, I don't know enough, and hopefully you'll address it a little bit, is some of the stuff that he's doing with dietary seems to be not bad. I'm not so much against GMO, again, with my very limited knowledge, but some of the things like the dyes and some other things that Europe has banned, I think that might be the one thing that I might point to that might be positive that will come out of his thing.
Yeah, that's such a good point, and that's, I think, where I'm going to wrap up this portion of the talk. But as you'll see, there'll be a lot of overlap as we go through other sections. But Cyril, that's where I'm at too. Sort of focusing on the importance of lifestyle and moving things upstream as a family doc and focused on prevention. I think there's an opportunity for, collaboration there. So thank you for that. Now, this next section, which will be the bulk of our talk today, is kind of like, why is this happening? Why the rise of MAHA? And my thoughts are rising mistrust and information sources that are buried and conflicting. And let's face it, the healthcare system, I've been a part of it for over 30 years, didn't really work that well. And as a result, not just as a result of that, but there's many reasons why we have poor health and other reasons as well. So we're going to tackle this one by one. This is my thoughts about what kind of got us here. Many different reasons. Certainly the COVID-19 pandemic and just the rise of certainly polarization and anger and distrust in public health specifically. And then there's rising health inequalities. And I think the chasm is just even getting wider, right? I think are people just with raising their hands are aware of the term social determinants of health?
Say it again.
Are aware of the term social determinants of health? Yeah. So a few of us are. Excellent. So the idea is that if you come to see me in my office or you go into any health institution, that's like maybe 20% of determining what your health outcomes are. The vast majority is where we live, work, and play, and what's available to us in terms of resources and what isn't. And so you've probably heard this, James, I'm sure you're aware of this, if it comes to different zip codes, have significant determination in terms of a person's health, whereas one zip code that even abuts another, there can be like a 20-year discrepancy in mortality and the age at which people die. So real significant societal structural problems. And then doesn't it seem like there's just a crazy amount of money in healthcare, and yet their insurances prices go up. Our copays go up, people can't afford their medication. It just doesn't seem right. So I don't know. I can see why people don't have trust. I think that's rather than asking you, and you certainly could have just answered the question of why you think there's lack of trust. But I'm also kind of interested in how do you rebuild the trust. So like I'm working in healthcare. I'm not going to retire anytime soon because my wife told me that. So yeah, like how do you build trust? So I'll just open that to the audience. That's an easy one. Cyril.
Say,
Do we have the? Okay.
I think this is what I harp on is this honesty. I mean, both sides are afraid to admit their weaknesses and praise the strengths of their opponents, which is why I'm so glad that you opened it up to what is good about Kennedy,
right?
How little that may be, because we need to know that especially if we're going to convince people on the right, on another side. I mean, I'm kind of right, but on the other side of any issue, we got to know what's good and what's bad, and I think there's been a lot of deceit I remember, I don't know, was it 20 years ago, there was that climate warming thing where the guy, the numbers were hoaxed and all that stuff, which just, if you don't do that, you're not going to open yourself up for that mistrust. If you're just honest with your weaknesses and honest with the strengths of your opponents.
Yeah, honesty, humility, absolutely.
I had, Betsy.
Hey, Betsy.
I had the opportunity to get involved with a depolarizing organization. This one is called Braver Angels, not Better Angels, because that was taken if you look it up.
Yeah.
It's only $12 a year to be a member, and then you can even view some of their events online. But I had the opportunity to go to their convention, and they make a point of having an equal number of Republicans and Democrats. And they had a lot of discussions that were parliamentary discussions that would normally be people just dissing each other. And they were held with a lot of respect. And they still had a sense of humor.
Mm-hmm.
And I made a point, I try to listen to all sides, and I think there's like a real warlike mentality in our culture rather than the mentality to actually listen to people that we disagree with.
Mm-hmm.
And, sometimes I will come away still disagreeing with people, but sometimes I won't. And I'll learn something new because I think sometimes we need to embrace the I don't know mentality and be open to learning.
Yeah, really well said.
So, I don't know if I'm right about this, but I kind of have a feeling that with so much of healthcare consolidation, and moving to for-profit structures rather than nonprofit, as well as insurance companies. Until we address that,
Yeah.
I think from a systemic point of view, we're going to continue down this path. I work in employee relations, and I get calls from employees all the time just complaining about their inability to get appointments, their inability to find a provider
Yeah.
in their areas, their inability to get a claim paid. It just goes on and on and on. And I mean, I know a number of years ago I had surgery, and it took me a year to resolve all of the expenses
Wow.
involved in the surgery. And I'm sitting there thinking to myself, like, I was not sick. If someone is sick and doesn't feel well and doesn't have someone who can take care of that stuff for them, how do they do
Yeah,
it?
if you don't have an advocate.
Yeah.
I'm just going to ask, just for a show of hands, how many people have had similar experiences to Terry in terms of their health care? Right. So the majority. I think, Ed, you had a question? Oh, I'm sorry, Pat.
Yeah, I was thinking about, the mistrust issue. I just remember being totally mortified during the COVID situation when the information would change, sometimes day by day, hour by hour, and people could not accept that.
Right.
That they just thought that there had to be one right answer, and anything else, we were being, lied to, et cetera, et cetera. So my feeling was something about our, educational system maybe, about, gee, science is ever-changing, and I'm no science person, believe me, but it's like science changes every 10 minutes maybe. You have to be able to absorb that information, okay, and not just chuck it all away. And that's what I found so many people bringing up. Oh, they don't know what they're talking about because one day it was this, the next one. Well, yeah. What's so difficult to understand about that in something that we've never experienced before? I had a hard time with people who, with that mentality, and I still do, and there's still a lot of them out there.
Yeah, lack of understanding of the scientific. I'm sorry, would you mind giving that to? Yeah, thanks.
I agree with a lot of things that I'm hearing here. One thing I was thinking before was just basic scientific literacy. I think will help
Right,
people,
right.
And empower people to trust the sources by learning how to read the sources and what's the difference between a source of a TikTok video and a peer-reviewed journal. I also very much, agree with the idea of depolarizing things, and I think that something that can be done at various levels, from the individual physician level to the healthcare organization level to the political level, is if you really want people to hear what you say, you have to listen to what they tell you.
Right.
And I think doing a better job of listening to the other side before pushing an agenda, gets people to trust you because they feel heard.
I'm going to take a minute to check in with my wife. How am I doing on time? So one more question for this topic.
Just a comment from me, because I'm somewhat skeptical of a lot of the information we hear from the pharmaceutical industry, which I don't always trust.
Right.
And I think that's a problem. Are they twisting the results to sell their product, or are they really trying to heal us? And I try to avoid chemistry some of the pharmaceutical stuff as much as possible. I try to do natural things, and
Yeah.
that's my thing. And so far it's worked. I'm pretty good for 83.
Well,
So,
I would
anyway.
not have guessed 83, so I think you're doing well.
But I think that's a lot of the trust that we have, or I have, and I think a lot of people have it. How do we trust the pharmaceutical industry, And how much control does the pharmaceutical industry have over decisions that are made in the government and everything? Anyway.
Even though I was going to wrap it up here, I want to ask you I want to follow up with you a little bit more on that. And I'm sorry, I know that you're a founder, but I forget your first name. What's your name again? Harley. Harley, you had just mentioned there about your distrust for pharmaceutical companies, and the distrust of that system seems to be kind of in alignment with MAHA. What do you think about that? Like, do you see the sort of the MAHA point of view when it comes to big pharma?
Yeah, I think they have some point. The problem with, at least with Kennedy,
Yeah.
specifically, is that it's not based on science.
Right.
I mean,
Right. Okay.
I mean, my problem is not with pharmaceuticals isn't against science, but the question of how are they twisting the science for their purpose, for their money pocket.
Yeah. Got it. Excellent points. Thank you so much. We're gonna just for the sake of time and other things to cover, we're gonna move forward. So, the other thing that I think, and we touched upon this a little bit, but I think health misinformation is a big part of the problem we're facing. Ed talked about TikTok, social media. Obviously, maybe we could ask Lily about TikTok. That's my daughter. But emotional content spreads faster, and a lot of times we talk about disinformation, and there is, people with significant, I think, malicious intent, but most of it is just not the intent to deceive. It's sharing what they think people think is accurate information. So it's different from the disinformation. But there's significant consequences, right? So, I'm seeing it daily in my practice, right? More and more people are vaccine resistant and vaccine hesitant and aren't getting preventive care. And that's going to result in real consequences to their health and the health of the public at large. And there is even an uptick of harassment and violence against health workers, especially like nurses doing their amazing work in acute care settings. So, real consequences. So, the question though is how best, and I know we've touched upon it a little bit, but I think, it would be good to explore it a little bit more. How best can we tackle this problem of alternative misinformation, bad information, disinformation? Yeah, sure is.
Hi, my name's Krista.
Hi, Krista.
I want to know who we is in that question. So how best do we handle mis or disinformation? Is that meaning like healthcare providers? Does that mean like society at large?
So I'm going to change my answer. Initially, I was going to say society at large, but when I think about my intent here is to learn how I can move forward. So I'm going to say, as physicians, healthcare workers, how best we could approach that.
I don't have an answer. I just wanted to clarify.
Understood. Understood. I was hoping you'd give me the answer.
I don't know if you've noticed, but I notice on YouTube, you have all these things that, videos of different kinds, and they've gone to putting a little disclaimer in the upper left corner when something is altered or synthetic. And this applies to everything, not just healthcare information. So, but there are some things where they should have put it and they didn't put it. So it's not completely taken care of, but that's at least the start in doing this. I know my daughter believes in all this bullshit that they have, and I can't talk to her because there's no way to convince her that what she's seeing is incorrect. So it's a tough fight, and I look for other solutions.
There was a question in the back row.
My name is Dev, D-E-V, and my comment is that in an effort to stop misinformation or disinformation, some good information is being lost. Because the system believes that whatever information they have is the right information, and everybody else is wrong. I'll give you an example. Dr. Max Gerson in 1928, from Germany, he came here, and he found a cure for cancer. He claimed to find it, and he started advertising in the radio. They killed him. They bribed his nurse and poisoned him. So he had information. According to him, it's the good information. And his granddaughter, Gerson, Charlotte Gerson, she ran a cancer treatment clinic in Tijuana for years and years. She passed away recently. So information is there. What's the right information? What they are giving us is the only right information, but there's a lot of other information, a lot of other medical procedures, Ayurveda, homeopathy, allopathy, whatever, which is being lost in an effort to claim that whatever information we have is the right information.
Thank you. My name is Sally. I'm a retired librarian. My last position was as the librarian for the Minnesota Institute of Public Health. And my biggest challenge was just telling people, consider the source. That's just all I have to say. If it's on YouTube, who are they? What are their credentials? And maybe your daughter won't be able to answer that, and then you can show her something that's in a peer-reviewed journal.
She claims that she has her own sources. And her sources are the real truth. And if you go look them up, they're just all bullshit.
Right.
And there's nothing you can do about that.
Yeah. Yeah.
Can history help out here? I mean, if you go back at, 50, 60, 70 years and they were doing science and healthcare and they were presenting it to the public, it's peer-reviewed, all that. Can history help us here?
Well, that's a good advertisement for the book club on Vienna. And so, yeah, we've been here before. And I'm sorry.
So I'm wondering, probably everybody in this room has had either, a less than satisfactory experience with the healthcare provider and some very good experiences with a healthcare provider. Do you think that maybe how physicians or PAs or CNs interact with patients? I feel like a lot of times I'm being rushed.
Yeah.
And they're not taking the time to thoroughly explain things. And I think that contributes to both ignorance on the part of patients, right? Because they're not being educated appropriately, and mistrust and susceptibility to misinformation. Disinformation, I mean, there's so much dis out there about a lot of things. Yep. That's critical thinking. That's just not happening. But I'm wondering about how we train our healthcare professionals to do a better job of interacting with patients.
That is such a great point.
Yeah.
I'm going to ask again for a show of hands. This will be a little bit, no, it's not going to be tough. Just who has felt in an encounter with their healthcare provider talked down to? Okay, that's like 80% of us. Yeah, so Terry, to your point, 100%. Cyril?
Yeah, I also think sometimes it's not even misinformation is the way the information is presented. I mean, in our Austrian Vienna book, the guy was Viennese who discovered that the best way to sell a car is not by talking about the car, but slapping a sexy woman in front of the car.
Right.
And so even now, you have you have these commercials for drugs, and yeah, they go through, this can cause heart problems and farts and diarrhea and gas and everything, death and whatnot. Yeah. But they have this, Leave It to Beaver family, going on there, and that Leave It to Beaver family seems to trump that. So one part of me says, let's just outlaw, ban, pharmaceutical ads. But I'm very pro-speech, and I don't want to do that, but we already regulate them, and maybe we could regulate them even more. And, you know, we know that this is manipulation. Putting these, you know, Leave It to Beaver scenes on there is just nothing less than manipulation. And if we just restrict the ads to, you know, a guy in a coat or something like that, listing the benefits and the drawbacks, you know, something like that. I mean, I don't know
That's
if
a
that
good
could
point.
be done, but something like that.
Question for the group again. Who knows how many countries have direct-to-consumer advertising on? Two. One is us, and what's the other one? Trivia. New Zealand, yes. Leave it to the librarian to get the answer correct. Yeah, the direct-to-consumer advertising, yeah.
That's fairly new.
I have 5 more minutes in this section.
No, you don't have much more time, but I also have a comment.
I know
Let me
your
just
name,
quickly
Terry.
say
Yeah.
that it worked for cigarette commercials.
Yeah.
So why can't we do it here too? And
So I just want to comment on this. It seems to me that the MAHA folks are actually starting to do the same sort of thing that they complain about for traditional medicine, and that would be in terms of the profit that's involved in it all, right? So my social media of choice is Threads. If you see someone posting MAHA content and then you go to their profile, they tend to be marketing something, right? Some sort of pyramid scheme type thing, right?
Yeah.
And then
Like our sister-in-law, right?
Well, and then I was just going to say, we have a family member on my side, I will put that out, it's my side, who is, I can't imagine how expensive the treatments that her group, through a chiropractor in Florida, whatever they're marketing, it's only the elite who can afford it. So,
Mm-hmm.
maybe pointing out like, hey, that's the pot calling the kettle black kind of thing.
Yeah. Carrie, do I have 5 minutes overall?
No, you're out of time on that one.
But I'm sorry, Christy, I think you had another question?
I did actually. So after thinking about it and listening to what everybody else said, I sort of wondered the counterpoint to your question to the group of who has felt talked down to by their healthcare provider is who has had something inadequately, poorly explained to them that they did not understand. Because we are living through a time where we are very lucky, there's been an explosion of progress, but that means that healthcare providers are increasingly specialized, and the challenge of explaining, okay, we have this new thing, but now I have to explain to you all of this science if I want you to really understand it. That's a really tall order.
Yeah, it is, yeah.
So I wonder if part of it is that's a really fine needle to thread of asking people in a very finite amount of time because of health insurance and everything else to figure out what is the appropriate level for me to explain this to this particular patient. That's really hard.
It is.
But I think that would be the best way to handle mis and disinformation is figuring out how to effectively communicate at the level that particular patient is at.
Yeah, such a good point. A kind of expansion, really, of Terry's point, and I would say have that in our curriculum, and in our residencies and afterwards.
I'd just like to make a comment
Yeah.
about going back to the education issues. I think I've been dealing with the healthcare system since I was 30 years old because I got rheumatoid arthritis and at a very young age. And I had to keep myself informed constantly about what was going on. Now, I didn't start out like that, I'm sure. I was petrified and scared and not knowledgeable at all. But I think we, the patients, have a responsibility to try and be as informed as they can be when they go in. In other words, know what their freaking symptoms are, you know? I mean, things like that. And I know that I'm certainly not great at that all the time, but I've gotten much better at it through the years because I realize that time is valuable for everyone, including me. And I find that most doctors appreciate that if you go in as an informed patient. You don't have to know everything, And I will say, quite frankly, through the years, I've said, what about if we do A, B, or C, and they go along with me? So, I mean, there is that part on us, and I think that we need to be, generous in how we think about the medical, and I'm not a medical professional.
Yeah, and also realistic, I think we'll go on. In terms of what I mean by that, Pat, is that like this is a reality. This is the system. I'm going to go to this next question because sort of for time. Carrie, what do I have overall in time? Just in 14 minutes, okay. So now this is from the Kaiser Family Foundation, which is a nonpartisan group that looks at health systems and health system performance and compares across countries. And this is filtered to age 15 to 49, but you'll see it's similar if you filter to other ages. The green is comparable country averages, so like wealthy countries that are well-resourced. And look at the blue, that's us. And this has to do with deaths per 100, so mortality rate. COVID-19, substance use, cancer, we're close. Cardiovascular disease, suicide, motor vehicle accidents, homicide, you name it. So the question is, yeah.
Are those numbers, are those raw numbers, or are they percentile of the population? Thank you. Thank you. I couldn't have my eyes.
Excellent. All right. I was actually worried about inviting Ed to this talk because I figured he'd ask a question that I couldn't answer. So thank you for answering that. So does that surprise people? You heard it? Ed's surprised.
It's that stark, especially for some of those indicators. It's COVID.
Yeah. Anyone else surprised by that performance? Cyril is as well? Yeah. The extent. Yeah, absolutely. Okay. Now, let's talk about vaccines a little. So, from my take, and again, I welcome alternative viewpoints, but I see that MAHA is promoting vaccine skepticism and questions about established vaccine science. And they're framing vaccine transparency as a core priority. But there has been, to my understanding, to my appreciation, transparency around the process. Let's think about the ACIP, or the American Council on Immunization Practices, that has recently been first disbanded and then reconstituted with people who are, from my point of view, vaccine skeptics, and linked really to this long-standing anti-vaccine activism. From public health perspective, as I was saying at the outset of this talk, there is, there doesn't seem to be a lot of overlap there, and hopefully I'm wrong. And we're already seeing these vaccines preventable outbreaks. I mean, did anyone see? I mean, I just was reading this morning in South Carolina, just the cases of measles, outbreak, and I mean that's just so tragic, I mean, how completely preventable. I talked about the ACIP. And there is a tying of vaccine hesitancy to corporate capture in public health, and I kind of like thinking about what Harley was saying earlier, like, how does that connect to sort of distrust around big pharma, and for really good reasons for having distrust. But, I'm going to talk about my own experience for just a little bit before I open up to this group, but like I get it why people have mistrust. I mean, I lived through the ongoing opioid epidemic, right? I mean, as a family doc, as a generalist, we were the ones who were targeted for prescribing opioids, and while being far from perfect, I can tell you that I was able to sidestep that one, thankfully. But there was a lot of sort of even systemic pressure around prescribing opioids. Like, we were graded on pain control, and there were people who were being sued for inadequate pain control, and there were all these ideas being put forward about different pain pathways that we needed to, get on top of right away, et cetera. So there was a lot of pressure. In fact, has anyone heard of what was called the fifth vital sign when it comes to pain? James is nodding his head, so yeah, it's, and Krista as well. So it's, for a period of time. So we were, that was, you were going to grade someone on a Likert scale, I think 1 to 10, about what their, maybe 1 to 5, what their pain was at any moment. And you were, as a healthcare provider, you were incentivized and really pressured, I think, to really focus on pain control, which oftentimes meant opioids. And as we know, and then in terms of like the information and the quality of the information, this was based on an article in the New England Journal of Medicine that was not even an article, it was a response to the article about a particular inpatient experience around pain control and the use of opioids in like a small number of patients while they were inpatient, and the occurrence of substance use disorder that resulted in it, which was like, basically none. And that was blown up to say, hey, there's research to support that this is completely safe for us to aggressively, and Ed saw the consequences of that, I know, in his own, and we've talked about that before. It's a colleague of mine. And so anyway, I can see why people have a distrust of big pharma. So that's sort of my experience. I guess I didn't plan for this question, but how on earth can we overcome this and get, from my point of view, and I think everyone else's, stop what's going on right now and get people vaccinated and children vaccinated when the rate of vaccine is declining. Yes, tell me, oh wait, let's get the microphone. Tell us your name and where you're coming from with this.
My name is Leo, and let's see, I feel like there's not a clear enough line in my mind that, at least that's communicated to the public, between like money interests in public health and actual science. I feel like vaccines are interesting because maybe 15 years ago, I would see a lot more vaccine hesitancy on, say, the far left, and it has swung to the far right, especially after COVID.
Right.
And at least some of the people that I've talked to who have been vaccine hesitant have said, have implied at least that a lot of it has to do with the fact that they saw kind of the behavior of the government or the messaging around vaccines during COVID-19 as disingenuous, or they were keeping something from us, or they weren't being honest. And I think a lot of that comes from the fact that there's the science, which I feel like is pretty much always open and clear about what it's doing, but then there's also the government side of thinking, well, if we tell the public X, Y, Z, are they going to understand it, or is that going to make things worse, and maybe we should change the message a little bit.
Right.
And there's also the question of these, say, pharmaceutical companies and such, which have financial interests, and then they're, say, talking to doctors, they're, for example, pressuring doctors to offer opioids and things like that. And to a lot of people who don't keep up with this stuff, then I feel like to them it's all one thing, and they're just seeing one thing that's causing opioid epidemics and giving disingenuous information about vaccines, et cetera. And so I feel like, I'm not sure how the specifics would look, but I feel like it needs to be clearer to the public what is basically something that is being given to them by science, what's, facts about the science that we know, and what is, public messaging, basically, that might be based on the science, but isn't the same thing and shouldn't be lumped in with it.
Right, right. Thanks, Leo. And any other thoughts? Jim?
I think the future of dealing with these issues about vaccine hesitancy is a political solution. I've got a quotation here from the new head of the Federal Vaccine Advisory Panel, a pediatric cardiologist, Dr. Milhone. He said flatly his goal is to make individual autonomy rather than public health the top priority in the country.
Right.
In the country's public health apparatus, and he even questions whether polio vaccines are needed. I mean, if you know, they're going to end up with a lot of data, bad news about people dying all over the place.
Yeah.
And I think it's a public change. And of course, our issue is that our healthcare is so weak that other countries don't have to be as strong in vaccines because they're getting reasonable health care all day long, every week. But our country has got so many people that aren't getting adequate health care that vaccines are a key strategy to keep disease and illness down.
That's such a good point, Jim.
So I'm thinking it's a political, we're going to have to see the political wheel turn. We're not going to change Kennedy's attitude, I don't think.
That's a good point. And we're going to get to you in just one second, but I actually wanted to, even though Cyril didn't have his hand raised, I wanted to, Cyril, ask a question of you. Because Jim brought up autonomy. And I think about that in terms of vaccine hesitancy and vaccine resistance. And quite often we view that through autonomy, like through a person's choice or a person's choice for their children. But what about other ethical principles, right? So we're thinking about autonomy. Well, what about beneficence or non-maleficence or justice or fidelity? I mean, do you have any thoughts about that, about how we balance it from an ethical framework?
Well, even the autonomy, and then, you know, on the other hand, it takes a community to raise a child, which I think was Hillary, right? That was lambasted for that by the right. And I was probably one of the ones that was lambasting her at the time, though I don't know I would do so now. But those things seem to be, again, restricted to your, you know, when it favors you. I mean, most liberals and myself included are all for autonomy when it's pro-choice,
right.
You know. But yet, you know, and the right-wing people aren't there, you know. But it's all, you know, it's more of a communal aspect in less autonomy when we start talking about maybe mandating vaccines or trying to, you know, influence other ways. So I don't know if that kind of answered your question, more focused on the autonomy thing. But yeah, I mean, I think the more we realize how interconnected we are, I mean, I used to be a very, very individualistic type of person, a typical, you know, traditional American. And over the years, I've become much more sort of aware of, I don't know of you know, if there's any real form of union, but at least one that I like to act as if there was some sort of real community.
Yeah, at least more of a balance, right?
Yeah.
Rachel, you had a question?
Yeah, I actually did want to talk about that idea of individuality versus community.
Yeah.
I actually have I'm an MPH, and you know, one of the things you do want to focus on when you are working with an intervention that you're trying to get people to do something or whatever, say vaccines, is to get, you know, their buy-in. Obviously, they have to make the decision, but you also want to make sure that they understand, you know, their the brain not working, you know, the consequences of their decision. You know, it doesn't just affect you, and so many public health things don't just affect you, but especially vaccines. And I think that I don't know, somehow we've lost the war actually on this. That people just think, well, I am more important than the community, so
Right.
I get to make this decision, and that for vaccines especially, it's just not true. You know,
Yeah.
you need, oh sure, you need to make this decision, but it has to be a decision that benefits the whole community, because we are a community and we can't just each go it alone. And I think that our media, our scientific media needs to work on that. You know.
Very much so.
We're losing.
Such a good point. Veronica had a question?
Yeah, I keep thinking back to when you asked, what could you do as a family physician yourself. And at first I thought, oh, the obvious answer is to fight fire with fire and get yourself a YouTube channel going or like TikTok or something. And I think you could certainly do that. I don't think it would hurt. But then I thought about the fact that if you know anything about social media, your wife is nodding her head. Unfortunately, if you know anything about social media, once you start watching stuff on social media, especially if you have an account, you get kind of locked into this algorithm.
Yeah.
So even if you made very informative messages on your channel, you're still not going to get to the people who are like Eve's daughter, like determined to, they're just going to keep getting fed the same nonsense over and over again. So you won't even, it would be very difficult for you to reach those people because they're just going to get stuck in that one algorithm.
Yep. That's a good point. And one that, I just find it really challenging to have a solution about, which again is one of the reasons that I wanted to do this. I do have a question for the group, which is sort of feeding off what Rachel has said. So this is a real world example. And I just want people to let me know if they think that, or which of these two options you think makes more sense to you. So this is actually happening in the health system that I work with. So in the Department of Family Medicine, patients and families who decline immunizations are still seen within that practice. And then for the Department of Pediatrics, there's a department level decision that in order to continue to be seen with that practice, your child needs to be immunized. Now there's obviously exclusions, and there's some practices that choose not to do that, but that's the position of each department. And you can see that exactly frames like, okay, I mean, our family medicine, that seems the primacy of autonomy. But what about these other ethical principles? And from the pediatrician's point of view, is there's a communal space. A child comes in who's sick. Well, what about a child what about an infant who is not yet able to receive a particular vaccine or is immunosuppressed, So who's right? Leo.
I feel like I feel like people should still receive treatment even if they refuse vaccines, because I think otherwise you just end up kind of feeding into the division between these groups, and it turns down basically an opportunity to to sway someone towards your own opinion, because I feel like one of the best things you can do to bring someone around to a certain point of view is just by having that person in proximity to or in conversation with people who they might not agree with, because naturally people just come to trust others like more if they just spend more time around them, have more positive interactions with them. And I think for a lot of people, the reason that they might be worried about vaccines is not because they've done a bunch of research and they have some like specific concern about a specific health condition. It's just because they feel like just like doctors in general or the public health system in general just kind of like isn't their friend, and can't be trusted. And I feel like if you can get rid of that feeling, I feel like a lot of people over time would be willing to at least try taking a vaccine and realize it's not actually going to kill them or whatever.
Yeah, that resonates with me. Krista, you had a...
I don't want to have to take my baby into a space where I can't feel safe because the person next to me might have measles.
Yes.
Well, and just because the family practice side has said we'll still treat you, they could go elsewhere, is my feeling. And I'm with Kristen about I don't want to go a place where my baby's not safe. When my kids were going for undergrad, they had to show proof that they had a meningitis vaccine
Yeah.
before they could enroll.
Yep. Yes.
Can I say one more thing? Sorry. I also think it's sort of analogous to you have to have insurance to drive on the roads.
Yeah.
Like if you're in society, the part of the price of living in society, if you don't want to participate in society, like, okay, you can be a hermit and live on a mountain, and there are some people that do that.
Right.
But like if you want to be in society and receive the benefits of being in society, then I think you need to fully be part of society. And we can have a discussion about like exactly where to draw those lines. But I have some pretty strong feelings about things that very clearly endanger other people through your choices.
Yeah. One of the, I'm sorry, if you could, this gentleman here, and then Veronica afterwards.
Yeah. So I guess going back a couple of topics, I did think of like one actionable thing for trying to combat misinformation hesitancy. I mean, on the subject of like, it's you don't have enough time with physicians. You don't have, you feel like you're being pushed out and all of that. Or rather, you don't have enough time with your patients. I don't know if that's the case with your practice, but I've heard with a lot of people, it's like, okay, you're just constantly shuffled through. You don't have a bathroom break. Is to increase the supply of physicians. What I know is it's impossible to get into medical school, right? And it's like, even if you lowered the standards, it'd be like moving on this section of the curve where like everybody would still be doing just as well on the tests. And it's impossible to get an internship. So as it stands, right, such a small percentage of the population is the kind of primary care folks who can actually like teach you about. I mean, there's lots of surgeons, but they can't teach you about basic biology. I guess that would be one actionable thing.
Yeah, absolutely. Would you mind handing it to Veronica, who's behind you?
Yeah, so this is kind of like a personal take on, and I can see both sides of not wanting to totally agree, totally understand not wanting to take your child somewhere or even yourself where somebody's been that wasn't vaccinated. But I can also see Leo's point of view where we should welcome both sides of the story because I have a sister that has 2 young children, and for years now she has refused to vaccinate them until I had a phone call with her about a month ago, and she told me that she decided to finally get her, I think she got her 2-year-old the measles vaccine, and I almost cried because I just never thought that we would get there. I never thought that, and she didn't tell me why, she finally decided to do it, but progress.
Yeah, nice. Good. Yeah. So, Krista, I totally hear what you're saying. One of the benefits of facilitating a discussion is that I don't actually have to make decisions on anything. I could just ask other people what they want. But having said that, like what Leos was saying made a lot of sense to me in that it's sort of an opportunity, right, to sort of have that ongoing discussion. And people have different reasons for, and sometimes they don't make a lot of sense to me in terms of choosing one vaccine or the other. First of all, no parent wants HPV vaccine for their child because apparently they think that will make them sexually active. but they, they're resistant to different types of vaccines, and that can change over time, and it has to do with sort of larger cultural issues. I'm sorry, go ahead.
Well, I was just going to say my boys have the HPV vaccine, actually.
Yeah.
And they're 12 and 14.
Good.
And yeah, I feel like our doctor was like a little bit pleasantly surprised. But I guess I just am asking that the consideration be taken for who is being asked to put themselves and their kids and whatever at risk to have these conversations. So like, I'm not saying that you as a doctor shouldn't have conversations with people. I'm just saying that like, in terms of practice decisions, pushing out people that decline vaccines puts the society and them at risk in different ways than taking them into your practice, which puts some of your other patients at risk. So I'm just saying that, like, I'm not, like I said, we're not even people that don't carry insurance on their cars or whatever aren't forced to become hermits, to go back to my earlier example. But they aren't allowed to legally drive. And so I sort of think that some of the safeguards that we do already have in place, such as expecting vaccines for public school attendance, I feel like that's appropriate.
Yeah.
And I don't want to see that removed in order to promote dialogue or whatever.
That's a good point.
I also
how
think that,
1 second. Oh.
I just think that we have a responsibility as well.
Okay.
Not just the doctors. You know, it seems like all of us, most of us, think that vaccines are good and that vaccines are necessary. And I do think that not just to like knee-jerk say, oh, why aren't you vaccinating? But to actually say there are reasons, and to really talk to people. If you know people in your life who are vaccine hesitant, ask them why, because you never know what the answer is. My sister is COVID. She didn't get her kids vaccinated for COVID, but I was able to get her boys HPV vaccinated because she was like, what's the point of getting them? They're boys. They're not going to get cervical cancer. And I was like, well, they could get other forms of cancer.
Right.
That one sentence did it, and now they're vaccinated for HPV. You never know what it's going to be. So we have a responsibility too.
Thank you so much. I mean, what a perfect ending to someone who has a master's in public health, you know what I mean?
They're still not vaccinated for COVID.
The last word, if that's okay. I mean, I know there's a lot, but I know we're at 10 after 12. So I was going to have an open forum, but we kind of already had the open forum. So I just wanted to, I'm not going to go over key takeaways. Just if you were interested, there's a bunch of good resources here. Complicating the Narrative is from Washington University Public Health, and just talking about the nuances and just how complicated these issues are. Commonwealth Fund and KFF really follow the data. OECD is the Organization for Economic Co-Development, and they really are a source of a lot of this information when it comes to health comparisons across countries. This is from Johns Hopkins, a good podcast on public health. What the Health is more about health policy from KFF. It's really good. And this one is a challenge, but worth it. Why should I trust you? And it has conversations really with people in the MAHA movement with others who would be more in the mainstream public health. So some of the conversations, quite frankly, I find frustrating, but it's important. But such great participation. Thank you so much for letting me talk with you today.
I would just like to make a suggestion that, 4 months, 5 months, 6 months, that you come back and we do this again.
Sure.
This was great. You really got people thinking, and I think it's an ongoing process, and it would be great. Thank you.
Yeah, sure. You don't think we'll solve it by then, Pat? All right, thanks again.
Thanks. Well, thanks, Dr. O'Neill. It was a pleasure having you lead our conversation. We love to talk about stuff. We just tear into it, right? We just love to talk about it. Any other comments or questions?